Hello and welcome to Notice Tonight. I want to focus tonight, viewers, on Assam's man of the moment, Health Minister Dr. Himanta Biswa Sharma and his team, who has built up a rather enviable medical infrastructure in Assam in a matter of about 2 weeks to fight the deadly coronavirus or COVID-19. When he began, there was not a single COVID-19 positive case in the state. Now, Assam's COVID positive tally is more than 24, 27 to be precise. Yet, there is no panic whatsoever because the medical personnel, starting from the doctors, nurses, paramedics, including ambulance drivers and others, both in the public and private sector, are fully geared up and motivated. Before anyone could think the Sorocharja Athletic Stadium was converted into a 1,000-bed quarantine center with a huge tented accommodation coming up almost overnight. Medical colleges being converted into exclusive COVID hospitals, with existing patients shifted to private hospitals with whom MOUs have been signed. To discuss the subject, I'm joined tonight by Principal Secretary Health, Government of Assam, Samir Sinha. Dr. Subhas Khanna, a reputed surgeon and head of the Swagat Super Speciality Hospital in Guwahati, is also with me. From Shillong, I'm joined by Patricia Mukim, editor of the Shillong Times, a well-known columnist. In Dibrugarh, I have the principal of the Assam Medical College, Dr. H.K. Goswami. And also joining me is Dr. Nivedita Barthakur, a health policy expert who works closely with the Assam Health Department and the Assam Health Ministry. Dr. Subhas Khanna, now you see, we have all seen, you are very much a part of it because the entire private sector, you were present in that meeting where the MOU was signed, you were part of the planning with between the interface between the government and the private sector hospitals in the state. Now my question is, what kind of a confidence, you are yourself a surgeon, you are in this field for more than 35 years. My question, Dr. Subhas Khanna, what kind of a confidence does it give when you see that your state is geared up to deal with such kind of a crisis which the medical world has not encountered before? And we are not particularly, the entire Northeast doesn't particularly have the best of healthcare facilities. So in this backdrop, when you see that Assam is well prepared, geared up, the government is there to take the issue extremely seriously, what kind of a confidence, what kind of a morale boost does it give to the medical fraternity, particularly the frontline medical workers?
Dear Wasbir, thank you very much for inviting me to this program.
Thanks for coming.
I bring greetings and best wishes on this World Health Day to all people, all sections of the society. I know we are passing through a very bad phase. A horrible pandemic is sweeping across all the continents. But when about 2 weeks back, we were all having nightmares. We were thinking that our ministry and our Honorable Health Minister should not repeat what mistakes Italy and the West has done. He invited us and took our opinion and comments. Although we gave various suggestions, but the fact remains that he has already done a lot of groundwork. He had already worked out his strategy. When I said we will need temporary hospitals, we cannot look at small hospitals, 50-bedded, to manage our COVID patients. The first aim of our Honorable Health Minister, Dr. Himanta Biswa Sharma, was not to infect and spread the infection to all parts of the region. So that was the main aim. That's why he did not bother to go take up all the private hospitals, by which we would have spread the infection to all these hospitals and to all the paramedical staff of the hospitals.
Absolutely, because we have seen the Wockhardt Hospital in Mumbai where 26 nurses have been affected. That is a private hospital. Now, Dr. Subhas Khanna, my question is, I was asking, I have not yet got the answer to that question. Suppose we were half as ready as what we are today in Assam. We already have 27 cases. And we don't want any more cases, God forbid. We let us stay at this. Now the point is, Dr. Subhas Khanna, suppose we were not prepared to this level. Do you think the medical professional, particularly the frontline workers, would have got that much of confidence? What do you think? Because do you think there would have been panic, there would have been things would have gone a little haywire, oh, what to do now, this kind of confusion all around? Do you think that could have been the scenario?
I fully agree with you. I think when our health minister took over this challenge, his aim were many. The first thing what he did was to infuse confidence in the all healthcare workers.
Yeah.
Because all of us, we were scared that there are 20% of the healthcare workers are dying in the Western countries, which are very well equipped compared to us. What will happen to us? So the first thing he did was to infuse confidence. Unlike any other, I won't say any other leader, I must say that all the leaders, all the hospital owners, all the hospital principals, all the professors and HODs were looking at a leader to take them out of this situation. So there came the role of our honorable the so-called HBS. So
Yeah.
he came forward
Right.
with a principle. He infused confidence in
so
all
that
of us.
confidence was given. There was
Yeah.
somebody from the government, a senior leader leading from the front, giving confidence. That matters a lot. Boost up the morale of the frontline medical workers, especially in this kind of a pandemic that is extremely virulent and that can extremely infectious. So in this kind of a scenario, confidence matters. Dr. Subhas Khanna, now we know that total of 2,000 tests have been conducted. Now there is an argument. I mean, it's not me saying this. There is an argument. A lot of people think that, just because we have very few tests conducted, only 2,000 in a population of 3 crore, otherwise the number of COVID patients could have been much higher. Do you buy this argument?
I think it's partly true. We should see, we have won a part one of the battle by restricting the patients. So what Korea did, they did testing on all the patients. So if we can increase the number of testing facilities, we could go to the next level of testing. Today we are doing sputum and mucus tests, which takes about 6 to 8 hours. If we can go for IgG, IMM, the antibody test, which will be, the results will be there in 10 minutes or 20 minutes. So by that we can cover a lot of population, and this should be our next step, I feel. So I will not comment on if you would have tested more, we would have got more positive, but it's partly true.
But tests is an important element in this kind of a situation. That's what you were saying.
At this stage, it is more important because we have done a pre-operative preparation. We are almost doing a surgical strike. Our health minister has prepared a surgical strike. So right now, we should be going for further and more testing so that we can contain it.
Dr. Subhas Khanna, did you ever think that there will be a convergence at one day in Assam between the government as well as the private sector, and that it will be so easy to come up with an MOU like this at the drop of a hat?
Not at all. We have never seen any minister personally calling us up and asking us to join the government. And this was a totally unexpected call from the government. And this is the first time ever it has happened. And I'm sure, although we are in the midst of looming clouds, but there's a silver lining. Our minister is there. And I can assure all the viewers, like the government officials, Mr. Samir Sinha is here, our health minister, all the health officials, we, the doctors and paramedical staff are all geared up. We will be there for your help, to help you and to help the government till it is required.
Absolutely. Very reassuring words coming from a senior medical professional like Dr. Subhas Khanna. I'd like to thank each and every single panelist for taking time out in spite of their extremely busy schedule to be on this show tonight and giving as much information as they can to the viewers in this time of crisis. I thank all my panelists for being on the program and the viewers for watching the show. This is not the last word that we are hearing, but we don't need to panic. We need to enforce the lockdown and move ahead as we have been behaving very responsibly in the last couple of days. We hope your cooperation in the days ahead. On this note, I end this edition of Notice Tonight. Good night and goodbye.